Welcome to this pharmacology quiz on topical antifungals. In this video, we will cover key drugs used to manage conditions such as tinea infections and cutaneous candidiasis. This quiz includes 10 recall-type multiple-choice questions. Each question has 5 options followed by the correct answer and a short explanation. The video will pause for a few seconds after each question to give you time to think before the correct option appears. So, let's get right into it. Question 1. The mechanism of action of topical azoles primarily targets inhibition of ergosterol synthesis through blockade of lanosterol demethylase. Which agent most specifically relies on this mechanism? Option A, clotrimazole. Option B, terbinafine. Option C, cyclopirox. Option D, amorolfine. Option E, nystatin. The correct answer is option A, clotrimazole. This is because clotrimazole is a classic azole that selectively inhibits fungal lanosterol demethylase to block ergosterol synthesis. All other agents act through different mechanisms, including squalene epoxidase inhibition, membrane binding, or multi-targeted disruption. Question 2. Topical allylamines are not equivalent to azoles in their primary enzymatic target. Which drug shows the greatest selectivity for inhibition of squalene epoxidase? Option A, terbinafine. Option B, clotrimazole. Option C, ketoconazole. Option D, miconazole. Option E, nystatin. The correct answer is option A, terbinafine. The reason is that terbinafine is the prototypical allylamine that potently inhibits fungal squalene epoxidase, leading to toxic squalene accumulation. All other drugs listed are azoles or polyenes that act on ergosterol pathways rather than squalene metabolism. Question 3. Which topical antifungal demonstrates superficial distribution with minimal systemic absorption and is preferred for cutaneous candidiasis in pregnancy due to low toxicity? Option A, terbinafine. Option B, clotrimazole. Option C, amorolfine. Option D, cyclopirox. Option E, iconazole. The correct answer is option B, clotrimazole. This occurs because clotrimazole is widely recommended during pregnancy due to its excellent safety profile and very limited absorption. All other options have less safety data or broader systemic considerations, making them less ideal in pregnancy. Question 4. The following statements regarding topical polyene antifungals are correct except Option A, they bind ergosterol directly. Option B, they cause membrane pore formation. Option C, they are active against dermatophytes. Option D, they have poor systemic absorption. Option E, they are used for superficial candidiasis. The correct answer is option C, active against dermatophytes. This is because polyenes such as nystatin do not have activity against dermatophytes and are restricted to Candida species. All other statements accurately describe polyene characteristics, including ergosterol binding, pore formation, minimal absorption, and candidiasis use. Question 5. A clinician comparing topical azoles and allylamines should recognize that azoles are not first line for dermatophyte infections when rapid fungicidal action is required. Which agent is fungicidal? Option A, terbinafine. Option B, clotrimazole. Option C, iconazole. Option D, thiaconazole. Option E, ketoconazole. The correct answer is option A, terbinafine. The explanation is that terbinafine's inhibition of squalene epoxidase produces fungicidal effects, making it superior for dermatophyte infections. All other listed azoles are fungistatic rather than fungicidal, resulting in slower clinical responses. Question 6. Which of the following topical drugs used for onychomycosis exerts its antifungal activity by disrupting sterol synthesis via inhibition of delta-14 reductase? Option A, amorolfine. Option B, cyclopirox. Option C, ketoconazole. Option D, terbinafine. Option E, nystatin. The correct answer is option A, amorolfine. This occurs because amorolfine uniquely inhibits delta-14 reductase and delta-7 to delta-8 isomerase, disrupting fungal sterol formation at multiple steps. All other agents use unrelated mechanisms, ranging from azole demethylase inhibition to squalene epoxidase blockade or membrane binding. Question 7. The following statements about cyclopirox are correct except Option A, it chelates fungal cations. Option B, it inhibits DNA synthesis. Option C, it is effective in nail infections. Option D, it is equivalent to azoles mechanistically. Option E, it has broad antifungal activity. The correct answer is option D, equivalent to azoles mechanistically. This is because cyclopirox acts through metal ion chelation and interference with fungal metabolic pathways, not via ergosterol synthesis. All other options describe established properties of cyclopirox, including its broad activity and usefulness in nail disease. Question 8. Compared with other topical antifungals, nystatin has limited spectrum and is not effective against dermatophytes. Which agent most closely shares this limitation? Option A, amphotericin B. Option B, terbinafine. Option C, amorolfine. Option D, clotrimazole. Option E, cyclopirox. The correct answer is option A, amphotericin B. The explanation is that both nystatin and amphotericin B are polyene antifungals with activity mainly against Candida species and other yeasts. They lack effectiveness against dermatophytes, unlike azoles or allylamines. Question 9. Which topical antifungal is preferred for tinea corporis when comparing agents from different classes, considering superior fungicidal action and shorter treatment duration? Option A, terbinafine. Option B, clotrimazole. Option C, miconazole. Option D, tiaconazole. Option E, nystatin. The correct answer is option A, terbinafine. This is because terbinafine provides rapid fungicidal activity and high cure rates in tinea corporis. All other options are fungistatic or inappropriate for dermatophytes, resulting in slower or ineffective treatment. Question 10. The following statements regarding the therapeutic use of topical antifungals in pediatric patients are correct except Option A, they have low systemic absorption. Option B, azoles are safe for infants. Option C, terbinafine widely licensed in this population. Option D, polyenes are safe in oral thrush. Option E, they require monitoring for irritation. The correct answer is option C, terbinafine is widely licensed in pediatric patients. The explanation is that terbinafine has limited pediatric licensing for topical use compared with azoles and polyenes. All other statements reflect commonly accepted principles of topical antifungal safety in children. The quiz is now complete, and thank you so much for taking part. Be sure to drop your score in the comments so I can see how you got on. For further reading, I recommend Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF, which also informs all guideline references used in this video. These trusted resources will help deepen your understanding of topical antifungals.